Shasta County uses many strategies to stop the spread of viruses such as COVID-19. One of the most important tools is contact tracing. The concept seems easy. Work with a patient to help them recall everyone with whom they have had close contact while they've been contagious. Then, alert the contacts of their potential exposure and ensure they don't spread it to other people. But this simple-sounding process requires a dedicated team of professionals with a blend of investigative and people skills.
For coronavirus, there is a daily temperature and symptom monitoring that happens. So a person on quarantine who is a contact would be prompted to call in every day with their temperature and their signs and symptoms. And then if there were any symptoms, then a nurse could direct them on how to get care. Contact tracing means that you are contacting people who have been exposed to a communicable disease. Public health nurses are working 7 days a week. As soon as we interview the case patient, the person who is ill, and we get the names, we would start immediately trying to contact those folks by phone and placing them under quarantine or isolation if they're ill. So it happens that same day. Usually, once you figure out that you have a case, what you're going to do is try to get those most close to the patient. So you're going to look at the household people, who they live with. Almost always it's everybody in the house that you're going to want to interview. Beyond that, you're going to look at the patient's social activities. Do they go to church? Do they work? Do they go to exercise class, the gym? All of those kinds of things. You're going to want to know the closest people who spent the most time with that person. Sometimes it can be very difficult if you're trying to go back 14 days in a person's life. There could be a lot of things that happen during that time. So what I have done in the past is to ask them to look at their online banking account to see what activities where they may have spent money so that they can trace back that. Also, if they have another person in the household that they did those things with, you can ask the close contacts.
Shasta County employs dozens of people who do this critically important work, which has slowed the spread of COVID-19 in our community. Learn more about local efforts to fight COVID-19 at www.shastaready.org.